Hi, I'm Dr. Manika Zeri. I'm a rheumatologist in Charlotte and I work at SouthPark Rheumatology. I'm excited to talk about the basics of lupus today. I'll start with my agenda. First, we're going to start off with what is lupus and who's affected by lupus. Then we'll discuss the causes of lupus and how it's diagnosed. I'll go through different treatment options as well as a special section of pregnancy in patients who have lupus. Let's go ahead and begin. So what is lupus? That's a great question because this is a very complex disease. It involves multi-systems in the body and it presents with a variety of symptoms that can vary from patient to patient. That means that no two patients' lupus presents the same way. The disease itself is characterized by periods of exacerbations and remissions. So 99% of patients who have lupus at the time of diagnosis do have a positive ANA. I'll talk about that in more detail when we discuss laboratory findings and diagnosis. Family members of patients with lupus are more likely to have lupus, which means that we see the condition run in families, but it is not necessarily genetic. That means that if you have lupus, it does not mean that your child will have lupus, but there's a higher chance. We also see other rheumatic diseases and connective tissue diseases run in families of patients who have lupus. The risk of developing lupus in a sibling is about 20% higher than the normal population. And we have also seen that identical twins may be as high as 50%, which means that there is some type of genetic component, but we're not completely sure what that means. Healthy family members are more likely to have abnormal blood findings. However, it doesn't mean that they have lupus. They may have a false positive ANA, which is commonly seen in family members, especially first degree family members, which means mother, father, brother, sister of lupus patients. Lupus is considered to be a chronic autoimmune disease. What is an autoimmune disease? The immune system normally functions to fight off viruses and bacteria to prevent your body from getting sick. When it is overactive, it could present as other diseases. So we do see a lot of autoimmune diseases in rheumatology, and they predominantly involve the joints, and we'll talk more about the different systems that are affected by lupus. However, what it means is that the body is attacking itself and causing issues in being in the skin or the joints. Therefore, it can affect anywhere in the body, and it is not just particular to the skin or the joints. There are several factors that can exacerbate the disease, and some of those are including various environmental factors. Sunlight is a unique environmental factor that specifically affects lupus patients. Exposure to the sun may bring out the disease or cause a flare of clinical disease. Patients are advised to wear sunscreen daily, and it is recommended that you wear sunscreen SPF 30 and above. Also, other sun protective measures can be taken, and that includes wearing long pants, wearing long sleeves, wearing a hat with a large brim, as well as sun avoidance. I advise lupus patients to spend no more than 20 to 30 minutes in the sun at one time, go inside, take a break, and then you come back out again. So 20 to 30 minutes at a time is the best. Cigarette smoking is another big environmental factor. We do know that lupus and smoking does not go well together. Therefore, patients who are diagnosed with lupus who smoke should try very hard to quit. There are several reasons this is important. One is because the cigarette smoking does make the disease worse. And another reason is because medications that are used to treat lupus don't work as well in patients who smoke. Infections can exacerbate lupus and cause flares. Viral infections specifically can evoke a flare, and it is recommended that patients who have lupus get a flu vaccine every single year and a pneumonia vaccine. It should stay up to date. And this will prevent the lupus from flaring and decrease disease activity overall. There are many drugs that can cause lupus to flare. There is a subset of lupus called drug-induced lupus. So patients do develop lupus-like symptoms if they're prone to develop lupus if they take this drug. This type of lupus is not lifelong. It should go into remission once you get off of that drug. Pesticides have been linked, but there's not very good data on that, and vitamin D deficiency as well. So you may find that your rheumatologist checks your vitamin D often. Approximately 1.5 million Americans have lupus, and we are getting better at diagnosing lupus. So more than 16,000 new cases are reported in the United States each year. The diagnosis of lupus varies among populations, and Hispanics and African Americans do have higher rates than Caucasians. Women have a prevalence higher than men. It is about 1 to 9 compared to females to male. The age is an important factor in diagnosing first signs of lupus. So this disease occurs in younger females, typically between the ages of 20 to 40. Saying that, it does not mean that only young females get lupus. Anybody can get lupus. Children can get lupus, and males can get lupus. Unfortunately, if this is diagnosed among children and men, it is typically more severe disease. So anybody can get lupus. Older people can get lupus. It's not as common to diagnose it for the first time in an older person. It may be that they've had symptoms for a long time that went undiagnosed, and we usually find it at a later age. There are several different types of lupus. The best known is systemic lupus, which can involve the skin, the joints, as well as in internal organs. There is a type of lupus called cutaneous or discoid lupus, which predominantly affects the skin without any of the systemic manifestations. These patients are carefully monitored. They may eventually develop systemic manifestations, but not everybody does. There are also we talked about a little bit earlier, drug-induced lupus due to different medications, which is quite different disease because it is not lifelong and will completely resolve once the drug is removed. There's mixed connective tissue disease, which is a type of lupus that presents with different rheumatic diseases. And there's neonatal lupus, which is lupus which affects an infant of a pregnant woman with lupus. Now we'll discuss the clinical manifestations of lupus, and there's a lot. So I'm just going to read off my list here and talk about more in detail. So manifestations of lupus include fatigue, joint pain, anemia, which means abnormalities in your blood counts, fever, headaches, swelling of the hands, feet, legs, around the eyes, chest pain, difficulty breathing, muscle pain, rashes, including the butterfly rash, which is called a malar rash. Patients can see hair loss, sensitivity to the sun, clotting problems, ulcers in the mouth and nose, and another skin finding, which is called Raynauds. It is color change of the fingers or toes when exposed to cold temperatures. The most commonly affected areas include the skin, the joints, blood abnormalities, and the kidneys. And it is important to know that even though there are a large amount of symptoms that are known to be associated with lupus, not every single patient experiences all of these symptoms. Typically what we see is the symptoms that occur at the first onset at the time of diagnosis are what present themselves with each flare. Some statistics on what the most commonly associated symptoms that present at the time of disease would include skin findings. About 73% of patients who have lupus initially present with skin manifestations. Others typically also present with arthritis, so about 62 to 60% of patients with lupus have joint symptoms as well. Other symptoms include fatigue, and that's about 50% of patients, and renal disease, which occurs in 16 to 38% of patients. There are a bunch of general symptoms which are difficult to diagnose but are commonly known to be associated with lupus, and these include general fatigue, malaise, and they can be due to complications of disease or the medications. Fatigue is a very common symptom, and this means that lupus is strongly correlated with depression. And we'll talk about other conditions that lupus is associated with, but depression is one of them, which can be due to the fatigue that occurs in patients who have lupus. Unfortunately, it is also difficult to pinpoint if fatigue is associated with the flare of lupus because it typically does not show up in blood test or any other serologic or clinical findings. Facial erythema or redness is a very common finding in lupus patients. It's seen in almost 80 to 90% of patients with lupus. This rash is typically called a malar rash or described as a butterfly rash, and I have a picture of it right here. The rash is exacerbated, made worse by the sun, therefore wearing sunscreen is very important. It is non-scarring. It may come and go at times. Rashes on the body can occur as well, and this is called subacute cutaneous lupus. It doesn't just involve the face, but can involve the torso. This type of rash is generally itchy, but also not scarring. It can be the type of rash we typically see in drug-induced lupus. These two types of rashes are the most common. There are a variety of other rashes, including discoid lesions, which are scarring, typically occur on the head and neck, upper chest and arms area, but can occur anywhere if severe disease. There are also more rare skin findings, including peniculitis. Peniculitis is inflammation of the subcutaneous fat. It does present with a rash with puffy, red, fat skin. This is treated as a flare, but more rare than the first two rashes discussed. Oral ulcers are a common finding as well. Patients who have lupus typically have ulcers in the mouth and may experience about 20 to 40 ulcers at one time. So here's a picture. And this is a picture of dry mouth. Dry mouth is something that's associated with lupus, a separate syndrome called Sjogren's syndrome. The symptoms of Sjogren's are dry eyes and dry mouth. So You get difficulty producing saliva. There's inflammation in the saliva gland and the tear ducts, which causes those symptoms and can definitely make oral ulcers worse. About 50% of lupus patients experience Raynauds. Raynauds is the symptom of color change in the fingers and toes when exposed to cold temperatures. Patients experience color changing, including red, white, or blue fingertips or toes. Here's an example of fingertips that have turned white in a patient with Raynauds. Raynauds typically affects fingertips and toes, but can include other areas such as the ears and the nose, the lips, and the nipples. What is recommended is keeping these areas warm and preventing getting cold, which is difficult to do at times, but wearing gloves is a good option. Patients can experience stinging or numbness, and typically this is relieved once the area is warmed. One of the most common manifestations of lupus is arthritis. It is seen in about 90% of patients who have lupus and can be one of the presenting symptoms. Typically it involves the smaller joints of the body, including the hands, but it can move from joint to joint. Most commonly, it presents as symmetrical disease on both sides of the body, and it is rarely deforming or erosive, which is seen in rheumatoid arthritis. Patients with lupus arthritis can experience something called Jacquard's arthropathy, which is caused by inflammation of the tendons in the hand, which makes them stretchy and easily bendable. It may look deformed to the naked eye, but if you were to get an x-ray, you would not actually see any permanent joint damage. So here's a picture of someone with Jacquard's arthropathy. The fingers are bent and deformed, but they are reducible, which means that you could move the fingers back because it is the ligament that's affected and not the joint. The arthritis in lupus, like I mentioned before, typically involves the small joints of the body. We do not see spine or hip involvement commonly. Knee involvement can be seen, but it typically only occurs in very severe disease where all the other joints are affected. So we've talked mostly about the milder symptoms of lupus and the more common typical symptoms of lupus, including the arthritis, the Sjogren's, Raynauds, and skin manifestations. And now we're going to talk about the more serious systemic complications of lupus and the different organs that lupus can affect. So probably the most common is the kidneys can be involved, and this is called lupus nephritis. This is often the most common manifestation in pediatric patients who present with lupus. It could be one of the first findings in pediatric patients. 60% of the patients who have lupus nephritis can develop severe complications requiring medical attention. Typically, when you do see your rheumatologist, your kidneys are assessed. It's why you may have to give urine frequently when you are get your blood work done. So younger patients, males, and African Americans and Hispanics are at a greater risk of developing lupus nephritis. And as I mentioned before, it typically occurs pretty early onset when you're first diagnosed, if it's going to occur. It's typically found within the first 2 years of diagnosis, but can occur at any time. This is why we obtain urine samples to look for protein. If increased protein is seen, it is a suggestion that we should make sure that the kidneys are involved and maybe have a patient see a nephrologist. It's a kidney doctor. This lupus nephritis occurs because of inflammation in the kidney, similar to what happens in other parts of the body in patients who have lupus. Any organ can be involved. The second most common organ involved is the cardiovascular system. Lupus is associated with accelerated coronary atherosclerosis and coronary ischemic disease. So patients with lupus have a significantly higher risk of heart attack compared to healthy age-matched females. So it is important to eat a heart-healthy diet and maintain exercise. The cardiovascular system can also be involved due to inflammation of the heart itself, including the fluid-filled sac which surrounds the heart and the muscle of the heart. This is not as common, but it can occur, and that is called pericarditis or myocarditis. Similarly, the respiratory system can be involved, and the fluid-filled sac around the lungs can cause serositis or pleurisy. That presents with shortness of breath difficulty with taking a deep inspiration. If too much fluid builds around the heart, then this is something that would require hospitalization in order to remove the fluid. Lupus can involve the nervous system. This is even more rare than the kidneys or the heart or the lungs, and can present with a variety of symptoms that don't always correlate to clinical or laboratory findings. So the different ways that lupus can affect the nervous system include difficulty with memory, causing confusion, anxiety, difficulty concentrating. As I mentioned earlier, depression and anxiety. There can be less common strokes or psychosis, seizures, meningitis. That would be able to be diagnosed if you had a lumbar puncture. That would help with the diagnosis. Peripheral neuropathies can occur in about 14 to 75% of patients, and this typically presents itself within the first year of diagnosis. Lupus can present with a variety of blood disorders as well, and what we very commonly see are abnormalities in labs, including low white blood cell count. Low platelet counts can be seen as well, and low red blood cell counts, which is called anemia. There are rarer blood conditions associated with lupus, and one of them is called antiphospholipid antibody syndrome, and this puts lupus patients at a higher risk for clot, but as I said, this is not commonly seen in lupus patients. We often see other diseases that are associated with lupus, but not due to lupus. And these would include thyroid conditions, such as hypothyroid, as well as Sjogren's, which we briefly discussed, dry eyes and dry mouth. Systemic sclerosis is another rheumatic disease, and this could be seen in patients who have mixed connective tissue disease. It presents with classic skin findings, including skin tightening. Fibromyalgia, we talked about, can be secondary due to having primary lupus. Probably the most common symptom of fibromyalgia would be fatigue and muscle pain. And a good way to deal with fibromyalgia related to lupus would be to practice appropriate sleep hygiene. Sleep hygiene means really evaluating what is causing difficulty in getting a good night's rest. So is it, first of all, difficulty falling asleep or staying asleep? If it's difficulty staying asleep, what is the factor that's causing early morning awakenings? Also limiting electronic use and caffeine, especially before bedtime, and practicing different relaxation techniques. Small fiber neuropathy is one of the neurologic findings associated with lupus. It also goes into fibromyalgia and the peripheral neuropathy. Osteonecrosis, which is an issue with the bone, can be exacerbated by a lot of the drugs we use to treat lupus, including steroids. And also steroids make lupus patients at a higher risk of developing osteoporosis, which is also just part of having the disease. You have a higher risk of developing osteoporosis, which is thinning of the bones, and that puts you at an increased risk of fracture. We worry about major osteoporotic fractures such as hip fractures, and patients who experience hip fractures have complications. So we want to prevent that, and you would obtain a bone density to determine if you have osteoporosis, as well as checking your vitamin D and taking calcium and vitamin D supplements. As you can see, lupus presents with a variety of symptoms, and this definitely makes diagnosing of lupus very challenging. There's no single test that is best to evaluate if you have lupus. It is important to be evaluated by a rheumatologist and the appropriate health history, family history, and physical exam be performed. Only then do we do blood test to confirm that there is a suspicion of lupus, and this is what the diagnosis is. You'll also see that a lot of radiologic studies are used to help in diagnosis. So in addition to history, physical exam findings, laboratory testing, and radiologic testing, this is how we determine if lupus is the correct diagnosis. Once there is a suspicion that a patient has lupus, the lab test that is used to confirm the diagnosis is called an ANA. And 95 to 100% of patients who have lupus have a positive ANA. Unfortunately, this test is not a good screening test because a large proportion of the normal population that does not have lupus also has a positive ANA. And that number is approximately 4 to 20% of the normal population can have a positive ANA. Besides the ANA, there are multiple other blood tests that are ordered. These include the different ANA subsets, and including complements, which are proteins that are part of the immune system, as well as the normal blood panel we talked about to look for those different blood abnormalities. We also may consider ordering antiphospholipid antibodies, which are 4 different tests, as well as RMP. In women of childbearing age, it is important to order the Roux and Law, which help us determine if a woman would be able to pass on lupus to her child or fetus. Once lupus is diagnosed, you may wonder who treats lupus. So definitely you have to be under the care of a rheumatologist that manages lupus and monitors to see if the disease is progressing, staying stable, and provides a majority of the treatments. However, the rheumatologist does require help of many other specialists. For example, if you present predominantly with skin findings or discoid lupus, you might be under the care of a dermatologist. If you have been diagnosed with lupus nephritis, you would have a close relationship with your nephrologist or your kidney doctor. Patients who have cardiac involvement would have a cardiologist, and patients who do give birth to a child who has lupus, or patients who are considering pregnancy, would be followed by a perinatologist. The next important section to discuss are treatment options. So the goal of the medications used in patients with lupus is to suppress an overactive immune system. This does not necessarily mean that the immune system is low or not functioning. The goal would be to get it to a normal level where it's not causing all the systemic manifestations that the disease presents with. So reducing inflammation is part of the goal, and improving the symptoms, which hopefully improves the quality of life for lupus patients. So there's various medications used, and the best medication to use in a flare of lupus are steroids, including prednisone or methylprednisolone. These work very quickly in getting a flare under control. A medication which is very specific to lupus is a medication called hydroxychloroquine or Plaquenil. It is an anti-malarial drug that came out many years ago and is known to be protective in lupus patients. So we do feel very strongly about lupus patients being on Plaquenil if they're able to tolerate the medication without any side effects. If so, it's good for lupus patients to stay on the drug to prevent the lupus from progressing. It's a very mild medication and safe overall. It doesn't have to be monitored with lab work as frequently as some of the other medications we'll discuss. And it is usually well tolerated, although it's difficult to predict if someone may have an allergic reaction, but most people do very well on Plaquenil. It helps with some of the more difficult clinical findings of lupus, including fatigue, and it's very good for the skin and joint disease. Doesn't typically cause nausea or stomach upset. You may hear your rheumatologist tell you to get an eye exam once a year if you are on Plaquenil, and this is because after 5, more like 10 years of use, it was found in a very small amount of patients that it could deposit in the back of the eye. But since we did find this finding in a small amount of patients, it's been recommended that everybody get a yearly eye exam to make sure that this deposition is not occurring. For more severe disease or systemic manifestations, we do use other immunosuppressive medications, which are a step stronger than Plaquenil. And those medications, I'll list a few. You might have heard of methotrexate, azathioprine, Cellcept. And for very severe disease, usually patients who are hospitalized with lupus nephritis, they may receive drugs such as Cytoxan or Rituxan. These medications are chemotherapy agents and are used to treat very severe organ disease. There are a lot of newer disease coming out on the market to treat lupus patients, and one of the newest medications we have is a medication called Benlysta, and this has been FDA approved to treat lupus patients. It's very good for skin, joints, fatigue, and has done very well in clinical trials for these symptoms. It does come in 2 forms, which are auto-inject, a syringe that you give yourself an injection at home, or IV, which you would come into the office to receive. The most important thing to know about medications to treat lupus is that they should never be discontinued without discussing with your rheumatologist. Some medications have to be tapered off, and some would be very dangerous to stop abruptly. So if you're having issues with your medications, definitely consider discussing with your rheumatologist before stopping the medication altogether. So the next section is non-medical treatments, because there are a variety of things that can be done at home to help treat your lupus. And first of all, education is important. Knowing about the disease and knowing that it has times of remission and exacerbations is important. So educating yourself by doing classes and seminars such as this is a great place to start. We touched on diet and nutrition. There's no special diet for lupus patients, but the most highly recommended would be a heart-healthy diet, since lupus is highly associated with coronary artery disease. So Mediterranean diet is one that is recommended by Dr. Calabrese at Cleveland Clinic for patients with rheumatic disease to follow. Exercise, also very important for the same reason, because of the high risk with heart disease. So keeping the heart muscle healthy, even though it is exposed to systemic inflammation, is important. Sun protection we talked about when we talked about the skin manifestation, so a reminder, SPF 30 and above. Rest is important, and decreasing stress overall, because physical and emotional stress can cause flares. So really taking care of yourself and reducing stress as much as possible. I know it's easier said than done, but that is also part of treating lupus. quitting smoking, because smoking and lupus just don't go together. The medications don't work as well, and it causes frequent flares. Keeping vaccines up to date, getting your flu shot every year is a very important part. And having a good support system through the foundation and through your friends and your family or religious support groups. Also, important part about lupus, because it can be highly associated with depression and anxiety. There are some complementary and alternative medical treatments which are used by lupus patients, which have not been studied as well. These include using turmeric to treat the systemic inflammation and arthritis. Acupuncture does have good results in different types of arthritis, so it has been translated to be used for the arthritis for patients with lupus. And newer would be CBD oil, which is thought to be generally safe, and many patients have had good results. It's important to talk about pregnancy in lupus patients, since this is a disease that occurs in young women of childbearing age. First of all, it is important to know that having lupus does not affect fertility. It is safe for lupus patients to get pregnant, but it depends on a lot of different factors. First of all, the best time to get pregnant is when you are not experiencing an acute flare. And if you recently had a flare, it would be best to wait about 6 months. The second important aspect about considering pregnancy in lupus is the medications. It is very important to plan a pregnancy in patients who have lupus. And the reason is because it is highly unadvised to get pregnant on certain medications because they can cause fetal malformations. And it's important to know which medications and how long the medication has to be discontinued before trying to get pregnant. There's also medications that can affect breastfeeding, so it's important to be under close care of your rheumatologist when you are planning on conceiving, after you've done so, and after you have delivered the baby. But the good news is if all of these precautions are taken, if the pregnancy is planned and you wait to have a baby 6 months after a flare and the medications are adjusted prior to conceiving, then most babies born to lupus patients do come out healthy. I have two good recommendations for sources to get more information about lupus, and obviously the Lupus Foundation is a very good resource, as well as the American College of Rheumatology. So these are two websites that can be utilized to get more information. And in summary, lupus is it's a complicated disease. It's a chronic autoimmune disease that presents with a variety of symptoms. It's not localized to any one part of the body, so each patient can have different symptoms and nobody's lupus is the same. Diagnosis is also not so clear-cut, and there's a variety of clinical history, physical exam findings, laboratory testing, as well as radiologic studies that help us get to the diagnosis of lupus. There are many different treatment options, and various treatment options are used for different patients depending on the symptoms they present with. And everybody's treatment options are individualized to what they are experiencing and what their blood work shows. And the good news is that the prognosis over time, the more we're learning about lupus and the more patients are being educated about lupus, the prognosis has gotten better. We do see that in older age, many people's lupus can go into complete remission, which is different than some other autoimmune diseases. So I'm very excited that I was able to talk to you about lupus today, and if there are any questions, I'm happy to answer them. Please reach out to the Lupus Foundation and I will get to any questions that you all might have. Thank you.